Have you ever been frustrated when trying to place a PICC line only to have it end up in the wrong position? You're not alone, but what if there was a way to make PICC line placement easy every time? That's what we're going to talk about today. Hi, I'm here with Level Up RN. In this video, I am going to teach you how to place a PICC line using a step-by-step method that will help you be successful every single time. If you're new here, welcome. I'm an RN and this channel is all about helping nurses level up in their career. So if you like what you see, make sure to stay tuned. Let's get started. Before you start, make sure you have all your supplies ready. For this video, I'll be using a 3 French 18-inch PICC line with a 20-gauge introducer needle. You'll also need gauze pads, an antiseptic wipe, a syringe with sterile water, a flashback syringe for flushing, a vein viewer, tourniquet, tape, scissors, a pen, and of course the patient's chart. I am using a mannequin for this video, but make sure if you're redoing this in real life to follow all safety precautions and infection control practices. Alright, let's do this. The first step is to have the patient extend their arm fully and then turn their hand downward. Have them bend their elbow and then place the top of their hand on the bed. This is going to allow you to access the veins on the back of the hand, which are going to be our target. Next, apply a tourniquet above the elbow and then use the vein viewer to identify a suitable vein. The vein viewer is going to enhance the view of the veins by shining a bright light through the skin. This is going to make the veins appear raised, which makes them much easier to see. If you don't have a vein viewer, don't worry. You can use the back of your pen light as well. Just turn the light off, shine the light through the skin, and it'll do the same thing. Once you've identified a suitable vein, use your finger to palpate the vein. This is going to help push the vein up against the skin and it's going to make it even more prominent. Now take your antiseptic wipe and use it to prep the area. Be sure to let it dry completely before proceeding. Next, use your non-dominant hand to stabilize the vein and use your dominant hand to insert the introducer needle. Insert the needle at a 15-degree angle and be sure to use a sharp, quick motion. Don't be afraid to go fast here. It's important to remember that you're going to be advancing the needle over a wire. So once you get through the skin, it's going to be pretty smooth sailing after that. Advance the needle until you see blood return in the syringe. Once you see blood return, stop advancing the needle. You're all the way in. Now it's time to remove the stylets from the PICC line and replace it with the guide wire. Be sure to leave the cap on the PICC line while you're redoing this because you don't want to contaminate the inside of the PICC line with any bacteria or debris. To do this, hold the hub of the PICC line and then advance the stylet into the PICC line. Once the stylet is all the way in, remove the cap and then advance the PICC line until it stops. At this point, you can either cut the excess tubing or leave it long and drape it over the patient's arm. I prefer to cut it short, so I'm going to do that now. Be sure to disinfect the prongs and then tape them in place using strips of tape. Apply the first strip of tape to the hub of the PICC line and then the second strip of tape to the back of the hand. Be sure to check the tape frequently for the first 24 hours post-insertion to make sure it is still adhered and in place. Now it's time to flush the line. Use a flashback syringe filled with sterile water to flush the line. Be sure to push the plunger all the way down to ensure that the line is patent. Once you've done that, you can remove the flashback syringe and then tape it shut. Be sure to follow your facility's policy regarding dressing changes. Typically, you're going to want to change the dressing every 7 days or if it gets wet or dirty. Congratulations! You successfully inserted a PICC line. Using this step-by-step method is going to help you be successful every time. Just remember to prepare first, find the vein, insert the needle, remove the stylets, replace the guide wire, flush, and dress the site. If you found this video helpful, be sure to like and share it with your friends. And if you're looking for more PICC line content, check out the playlist. Thank you so much for watching. I hope you check out more content. And as always, you can find the references used in the video description. Be sure to stay tuned for more content. Take care.